Today I'm talking about Medicare enrollment, how to do it, when you need to do it. It's definitely important information, so stick around. If you are approaching your Medicare eligibility, there are important things to know about your enrollment that can really save you a lot of time and headache, and that is what we're going to review today. My name is Stephanie Apt. I am a licensed independent Medicare broker, and I create these videos in order to help simplify the Medicare process and just answer some of my most frequently asked questions. If you find this or any of my other videos helpful, please feel free to like the video. Definitely go ahead and subscribe to the channel and leave your comments and questions below. Now, Medicare is a federal health program for folks 65 and over, certain people under 65 with disabilities, and people with end-stage renal disease. The two main parts to original Medicare are Parts A and B. Medicare Part A is your hospital insurance coverage, and Medicare Part B is your doctor and your medical insurance coverage. When it comes to signing up for Medicare Parts A and B, some people are going to be automatically enrolled and not really need to do anything, while other people will actively need to enroll in Medicare. And in most cases, this is going to depend on whether or not you're collecting Social Security benefits. If you're turning 65 and you are going to be getting benefits from Social Security or from the Railroad Retirement Board for at least 4 months before you turn 65, then the government will automatically enroll you in Medicare Parts A and B. You don't have to do anything at all. Your effective date will be the first day of the month that you turn 65, unless you're born on the first of the month, in which case your effective date will be the first day of the month prior. But for most people, it's going to be the first day of the month that they turn 65. You will automatically get your red, white, and blue Medicare card in the mail about 3 months before your birthday. It's going to come in a little envelope from CMS, and it's just a paper card, so make sure to keep an eye out for it and don't accidentally throw it away. If you are turning 65 and you're not collecting Social Security benefits, then you will need to actively enroll in Medicare during your initial enrollment window. So your initial enrollment window is a 7-month window, and it starts up to 3 months before the month that you turn 65, and it goes up to 3 months after the month of your 65th birthday. If you enroll before your birth month, then your effective date will generally be the first day of the month that you turn 65. If you enroll after your birth month, your Medicare Part B effective date could be delayed, and this chart shows you when you can expect your Medicare Part B effective date based on the date of your enrollment. There are a few different ways that you can enroll in Medicare. One way is to go down to your local Social Security office and get signed up. Not necessarily the most fun, but definitely an option. If you go down to your Social Security office, I would try to make an appointment in advance if at all possible. Another way is to call Social Security. You can use the number on the screen right now to call Social Security and enroll over the phone in Medicare. And additionally, what I think is the simplest way is to just go ahead and enroll online in Medicare through Social Security. Now, you can generally enroll in Medicare online if you are within 3 months of turning 65 or over, you want Medicare benefits and you don't already have them, and you are not wanting to enroll in Social Security benefits at this time. And I'm going to go ahead and walk you through the updated process of how to enroll online in Medicare. So in order to apply online for Medicare, you're going to start here. And this is at ssa.gov/benefits/Medicare. And this will bring you to the Medicare online application. So there's this big blue button in the middle of the screen that says apply for Medicare only. This is signing up for Medicare, not Social Security benefits, just Medicare online. What you're going to do is you're going to go ahead and click on this button to start your application. This also will give you a way to return to a saved application if you don't finish your application all in one sitting. So I'm going to go ahead and click on this box. And you'll see that when you do this, it asks you to agree to the terms and conditions. Then you click next. And it lets you know some of the things that you may need to do to get ready, making sure that you meet the requirements to apply online for Medicare and the information that you may need to complete the application process. Once you have all of the information that you need, you'll go to start a new application. Then you'll click that you're applying for yourself. And then it's going to ask you if you have a My Social Security account. If you do, you'll click yes, and you'll be prompted to log in to your My Social Security account to finish the application process. If not, then you will have to create a My Social Security account in order to apply online. But it will ask you if you have an address in the United States or the U.S. territories, and you must have an address in the U.S. or its territories in order to create the My Social Security account and apply online. So then, just pretending I don't have a My Social Security account yet, I would go ahead and click on Create New Account. And it would prompt me to create this account, and then I would log in to complete the application. When you are completing the application online, you'll be prompted to enter in personal information about yourself. Now, the entire online application usually takes about 10 or 20 minutes. And like I said before, you can always stop and come back to the application at any time. They will provide you with an application ID number, and you can use that to log back in and to pull up the application you've been working on. At the very end of the application, there is a button that you'll see that says Submit Now, and pressing that button will submit your application to the Social Security Administration for review. You will see a receipt on the end screen, which you can go ahead and print out and save for your records. And then you will get a letter from the Social Security Administration once they've reached a decision about your Medicare enrollment. Additionally, I've linked the website below that you can go ahead and click on to get started. Some people are actually going to want to delay enrolling in Medicare, especially Medicare Part B, if you are still working or receiving employer-based health coverage. I'm going to link a video below that we created that goes into much more depth on when you may want to delay Medicare Part B if you're still actively working or you fall into certain specific situations. And once you go ahead and get signed up for Medicare, you're going to want to figure out how you'll be getting your Medicare Part D prescription drug coverage and your Medicare supplemental coverage as well. And that's where I would be more than happy to help. I am an independent broker. I am licensed in and work in most states nationwide, and I would be happy to provide free, no obligation quotes for these plans for your area. In summary, I really hope this video helped to simplify the Medicare enrollment process for you a little bit. Hope you found it helpful. Please feel free to reach out to me with questions at any time. You can give us a call, you can shoot me an email. I would be happy to help. Thanks so much for watching, and we'll see you soon.